Humans have always been searching for ways to stay disease-free. Although there were no specific health education and promotion programs, there has always been an effort to maintain health to live and thrive. The strategy of trial and error was used by early humans to distinguish between healthful or harmful things in their world. It is easy to imagine that the early humans would eat something like a fruit or a plant and then tell someone the outcome of eating them. If it were a desired effect, I am sure the consumer of the fruit or plant would encourage others to eat it. If the consumer became ill or died, we can believe that everyone else would be discouraged from eating that same fruit or plant. The notion of encouraging or discouraging someone from eating something is the same as educating them on health consequences of eating it. So, the earliest of humans introduced the notion of educating about health through trial and error. This led to more health-related knowledge, discoveries in following cultures and societies. The Egyptians, whose empire began roughly around 3100 BC, were one of the first cultures to be conscious about their health and are considered to be the healthiest people of their time. Healthiness can be attributed to their early health education and public health ideas. They primarily relied on their priests for all health and even medical information. This meant that they believed disease and illness was punishment from the gods, so they did things like wear makeup on their eyes. However, knowledge about disease and cleanliness motivated their people to take protective measures to ensure that they remained healthy. The Egyptians were known for using mosquito nets during the hot months to protect themselves against contracting malaria from the mosquitoes. The priests also washed themselves, clothing, and eating utensils regularly. The Hebrews, whose culture dates to 1500 BC, continued the Egyptian hygienic thought. The Hebrews wrote the biblical book of Leviticus, which is known as the world's first written hygienic code. In this book, the Hebrews discuss the cleanliness of the body and protection against the spread of contagious disease, such as isolating lepers. The book of Leviticus also provided more personal and community responsibilities that included sanitizing campsites, protecting water and food supplies, and even specific hygiene rules for menstruating women or women who recently gave birth. Women were not allowed to be touched for 7 days after giving birth to ensure cleanliness. The Greeks were the first culture to emphasize disease prevention. Just like in many earlier cultures, religion played an important role in healthcare for the Greeks early on. Asclepius, from the Iliad, was enshrined as god of medicine by the Greeks and was said to have 2 daughters that had health-related powers. His daughter Hygeia had the power to prevent disease, and his daughter Panacea had the ability to treat disease. The roots of the word hygiene and panacea came from the name of Alypius' daughters, both of which are used today in health education. Followers of Asclepius, known as Asclepiads, eventually began to practice medicine based on rational principles in temples that they built. The caduceus, which is a symbol that shows 2 snakes braided around a staff, could be found in temples of Asclepius. This symbol is now used by physicians today. The Asclepian tradition continued to influence early health education with people like Hippocrates, a famous Greek physician from the Asclepian tradition, who taught that health was the result of balance, and disease was the result of imbalance. In his book, Airs, Waters, and Places, Hippocrates discussed how the location and environment could affect your health. This book, or treatise, was the first recorded systematic effort to find the causal relationships between environmental factors and disease. He was essentially observing association between diseases and factors such as geography, climate, diet, and living conditions. It must also be noted that the Greeks did not view diet as we do today. Diet during the Greek time involves an entire lifestyle and way of living, from the amount of sleep you get to exercise and choice of food. The distinction between the words endemic and epidemic are another contribution made by Hippocrates. His notion of balance of life is still being promoted today, and there was no new change in the science he introduced until bacteriology and immunology emerged. The rise of the Roman Empire, which lasted from 500 BC to 500 AD, led to the conquering of the Greeks. However, their culture was not destroyed by the Romans, yet helping to further the advancement of health education and practices. The Romans were able to build efficient aqueduct systems that were able to provide at least 40 gallons of fresh water to its citizens per day. The Romans also had an extensive underground sewer system that carried off surface water and sewage and dumped it into the Tiber River. The need for Romans to provide fresh water and rid their cities of wastewater speaks to how educated they were on the importance of health and cleanliness in everyday living. Romans also understood the effects of occupational hazards on health and in turn built the first hospitals. In conclusion, these early human cultures and civilizations deserve a lot of credit in helping establish health education and promotion. Even though health education and promotion did not become a recognized profession until 1997, early human history is littered with people acting as health education specialists. The advancements made during the time of early human cultures and civilizations were centuries and sometimes thousands of years after its inception. Without the Egyptians, Hebrews, Greeks, and Romans, there would not be a health education promotion field.